Hello all, I'm Dr. Neema Bhatt, Senior Consultant, Hemato-Oncologist, Bone Marrow Transplant Physician, and also a Pediatric Oncologist. Today is World Cancer Day, and the cancer that I cure or try to cure is blood cancer. Have you heard of this term, leukemia? So leukemia is nothing but the medical term we use to describe a type of blood cancer. Now, what exactly is leukemia and how dangerous is it? Can it be life-threatening? Can it be cured? The moment we disclose or discuss a diagnosis of leukemia with a patient or their family, we can see the change in their emotions. We can see, the fear that they go through, the amount of fear that, they can think of, imagining long treatment, painful chemotherapy, multiple blood transfusions, lot of infections. So it is a dreadful picture for the most part. However, blood cancer is also one of the most curable or controllable cancers in today's oncology world. So leukemia is a type of disease that affects our blood disorders and basically makes them proliferate or multiply many times over very fast and causes our WBC counts to become very high or very low. At the same time, takes away all the raw materials and all the resources that goes into making normal blood cells. So these patients end up having low hemoglobin, which causes them to have low energy, a lot of fatigue, they have body pains, they get headaches, they feel dizzy. Also causes these patients to have low immunity because their normal WBC counts are low. So these patients have fevers, they are more prone to infections and they get respiratory infections, sinus infections, and stomach infections. Also, leukemia can cause low platelet counts. So patients with leukemia can have presentation or symptoms with nosebleed, easy gum bleeding, bruising, which are nothing but bluish patches on your body, small red dots we call petechiae, bleeding in the gut or in your stools, excessive menstrual bleeding or periods bleeding. So all these are symptoms that usually make up the patient who presents with leukemia. Apart from this, they also have non-specific body pains. They have a history of weight loss. In spite of trying to increase their intake, their appetite is absolutely very low. They're not able to take in food, because of which they lose a lot of weight. They have bony pains because these cancer cells multiply inside the bones and it starts damaging bones. They can have severe back pain, which also because these cells are made mostly in the bone. How treatable is leukemia and what do we do to diagnose it and treat it? As hematologists, it's our first job to first identify leukemia. So once the patients come with these symptoms, or if you go to your physician, they would get a very simple test called complete blood counts, which give us an idea about how your counts are. What is the level of your hemoglobin? What is the level of your WBC count? What is the level of your platelet? And we look at the same blood under the microscope and look for any abnormal cells or atypical cells. These are called blasts, which will signify if you have leukemia. Apart from this, for appropriate diagnosis and so-called staging or risk stratification, we do a simple procedure. As hematologists, we do this procedure called bone marrow aspiration biopsy. It sounds very scary, as in somebody's putting a needle inside your bone, getting tissue out. So it sounds very painful and scary, but we do it with local anesthesia, making sure that the area from where we're taking the sample is appropriately numb and you don't feel the pain as much. I compare it, very often to taking blood from an IV. So unless I took blood from the IV and sent for tests, I would not know what exactly your counts are at. Similar way, unless I did a bone marrow aspiration biopsy and sent those samples for testing, we would not be able to come to an accurate diagnosis about what exact type of leukemia it is and how many blasts are there and some other factors we look at before we say this is high risk, low risk, average or intermediate risk, a lot of factors. Now, there are also different types of leukemias. So there are acute leukemias and chronic leukemias. Acute leukemias are usually, the blood cancers that really proliferate or are very aggressive, and they can go from nothing to maximum cancer load in about 2 months, 3 months, 4 months time. And chronic leukemias are diseases or blood cancers that can last for months together, sometimes even years together, before the patient has even an idea that they have leukemia. Acute leukemias are more common in the younger generation, as in people who are in their teenage years or their 20s, and later in people who are above the age of 50 years. Chronic leukemias can also be found. Chronic myeloid leukemia is found in all ages of patients, but also more common in the 20s, 30s, and after that, in patients who are above the age of 55, 60 years of age. CLL, or another type of chronic leukemia called chronic lymphocytic leukemia, is usually more commonly found in patients who are above the age of 50, 55, and doesn't tend to occur in younger patients. The acute leukemias, although they are very aggressive, are also very responsive to treatment. So if they are identified or diagnosed at the right time, and the right kind of treatment is started by a specialist, which is usually a hematologist, the response is excellent. The way we pick medications based on the age of the patient, their other comorbidities, so if they have any heart conditions, if they have any liver problems, if they have sugar or BP, all these other things, we take everything into account before we come up with a proper customized treatment plan, whether it is for patients with acute leukemia or chronic leukemia. And with treatment, even patients with an aggressive disease like acute leukemia, we are looking at cure for these patients because these cancers are responsive to chemotherapy. It just requires these patients to be monitored regularly, for them to receive blood transfusions or platelet transfusions, as required. They need antibiotics because of the risk of infection. But if treated the right way, we are looking at an excellent treatment rate or response rate up to the range of 80 to 90% in most patients, and even up to the range of 90-95% for CML and CLL, for the chronic leukemias. So I urge you to do a little bit more research, to find out more about leukemia, to visit, appropriate centers if you know a family member or a friend who's diagnosed with blood cancer. And please don't shun away from treatment, because now there is a lot of thinking, we'll go for Ayurveda treatment, we'll go for homeopathy. It's not so severe, or it's too severe. Let us not even think about treatment. There is no hope, there is no cure. So such outset or such mindset should definitely be removed from people's minds, because blood cancer, even though it is the scary word cancer, it is definitely very, very curable. And if you meet the right person, the person with the right skills who's able to diagnose and treat it accordingly, as I said, it's one of the most curable cancers that are known to mankind. Please feel free to reach out so we can help you at Therapy Hematology and Oncology Cancer Center. Thank you.